All right, today we're diving deep into a truly fascinating clinical puzzle. We're talking about Clarkson's syndrome, a rare and really severe condition, and a potential treatment that's, believe it or not, probably sitting on a shelf in your hospital pharmacy right now. We're going to look at this mysterious vascular leak and how an old drug, colchicine, might be the new weapon we've been looking for.
So picture this. You have a patient who comes in with what looks like just a bad case of the flu. But then, fast forward just a few hours, and they're crashing. They're in hypovolemic shock, their body is swelling up, and their organs are shutting down. So what's the cause? It's almost unbelievable. Their blood vessels are literally springing leaks, just pouring plasma out into their tissues. This isn't something out of a movie. It's a very real, incredibly dangerous emergency called Clarkson syndrome.
Okay, so the official name for this is systemic capillary leak syndrome, or SCLS. You'll also hear it called Clarkson's syndrome, named after Dr. B. Clarkson, who first described it way back in 1960. But what does that actually mean? Well, think of the lining of your blood vessels, the endothelium, as this super important, tightly controlled barrier. In SCLS, that barrier just fails. It becomes incredibly permeable, and that leads to these massive, catastrophic fluid shifts. So the big question is, why? What could possibly cause the body's entire vascular system to just lose its integrity like that? Well, it all comes down to one thing: a massive, overwhelming inflammatory response.
The main trigger, as one of our sources puts it so well, is a tempestade de cytocinas. I love that term. It translates to cytokine storm, and that's exactly what it is. And we're not talking about your everyday, run-of-the-mill inflammation here. This is a completely out-of-control, dysregulated flood of signals that just steamrolls the body's normal defenses.
And if you look at the heart of this storm, research keeps pointing to a couple of usual suspects: interleukin-6, or IL-6, and tumor necrosis factor alpha, TNF-alpha. Now, normally these guys are crucial for a healthy immune response, but in a cytokine storm, they're released in such insane amounts that they basically go rogue. They turn toxic and start attacking the very systems they were meant to protect. And what's their main target in this rampage? It's the endothelium. This cytokine onslaught directly hammers that delicate single layer of cells lining our blood vessels, completely wrecking its ability to act as a barrier. And as if that wasn't bad enough, this inflammation kicks off a really dangerous chain reaction. It's not just about leaky vessels anymore. It also sends the body's entire clotting system into complete chaos. You end up with all these abnormal platelet counts and coagulation factors, which puts the patient in a prothrombotic state. So you've got this terrible, vicious cycle of leaking and clotting happening at the same time. And the downstream effects are, frankly, terrifying. One of the sources we looked at lays it out very bluntly. This cytokine storm leads to vascular leakage, disseminated intravascular coagulation, you know it as DIC, multi-organ dysfunction, shock, and ultimately, death. The message here couldn't be clearer. Getting a handle on this initial inflammation isn't just treating symptoms. It is, quite literally, a matter of life and death. So let's just recap the whole destructive process. The cytokine storm damages the endothelium. The connections between the cells just break apart, and suddenly the floodgates of the vascular system are wide open. Plasma, proteins, everything just starts pouring out into the body's tissues. And that is what creates the absolute clinical catastrophe that we see at the bedside. Okay, so we've got the why down, we understand the mechanism, but what does this actually look like when a patient presents? Recognizing SCLS can be incredibly tough, mostly because it's so rare and the early signs are super vague. But it does tend to follow a pretty distinct three-phase pattern. It really unfolds in three key stages. First, you have the prodromal phase. This is the tricky part. It just looks like the flu, maybe some stomach pain, nausea. It's so easy to miss. Then, bam, you hit the acute or leak phase. This is the crisis. This is where you see those huge fluid shifts, the massive swelling, the shock, the organ failure. But here's the kicker. Even if you get the patient through that, the recovery phase is just as dangerous. All that fluid starts rushing back into the blood vessels, and now you have a massive risk of fluid overload, pulmonary edema, even cardiogenic shock. It is a terrifying clinical balancing act.
Yeah, it's a really grim picture. But what if we could step in and hit the problem right at its source? What if we could stop that inflammation in its tracks? And that's where the story takes a really hopeful turn, because it brings us to a very old drug that's being looked at for a brand new, potentially life-saving job. And that drug is colchicine. Now, most of us know it as a go-to for gout, right? But it's how it works that makes it so compelling for this. Colchicine basically gets inside immune cells and messes with their internal scaffolding, their microtubules. What does that do? It essentially paralyzes them. They can't move to where the inflammation is, a process we call chemotaxis, and they can't spew out all those damaging enzymes. It stops them cold. Now, this idea didn't just pop up out of thin air. It actually started with a really interesting observation. Doctors and researchers noticed that patients with gout who were taking colchicine all the time seemed to be having fewer heart attacks. That was the spark. It got people thinking, hey, maybe colchicine's anti-inflammatory punch is actually protecting the heart and blood vessels by tamping down the inflammation that causes things like atherosclerosis. And since then, the evidence has just been piling up from all sorts of different areas. You've got a study on post-transplant patients with SCLS showing an impressively rapid response. Then during the pandemic, it was flagged as a potential therapy for the hyperinflammation we saw in severe COVID-19. And in cardiology, systematic reviews have confirmed it works for secondary prevention. You see the pattern here, right? Wherever you find dangerous vascular inflammation, colchicine seems to be a player. I think the authors of that SCLS case report really nailed it. They said that their, and I'm quoting here, strikingly positive experience forces physicians to consider this old and cost-effective drug as a new, powerful rescue tool in such critical cases. I mean, you can't get much clearer than that. That's a huge statement, a real call to action. So let's wrap this up. What's the big takeaway? What's the new tool we should be putting in our mental toolkit after hearing all this? It really boils down to something this simple. You've got the problem, this terrible cascade of hyperinflammation leading to endothelial damage, leading to a massive vascular leak. And then you have the potential solution, which gets right to the root of it all, colchicine, with its anti-inflammatory power potentially leading to vascular stabilization. It's about shutting off the leak at the source. You know, this whole story about colchicine and Clarkson syndrome leaves us with a really big, thought-provoking question. We live in this age of incredibly expensive, super specialized biologic drugs, and it just makes you wonder, how many other powerful, cheap, life-saving treatments are hiding in plain sight, just sitting right there on our pharmacy shelves, waiting for us to give them a second look?